right, we are live at Drake University in Des Moines, Iowa, to hear from the Democratic presidential candidates and the people who matter most in this election, the voters. Welcome to our viewers in the United States and around the world, and of course, here in Iowa, where we're being seen on our CNN affiliates across the state. We also want to welcome our servicemen and women who are watching on the American Forces Network around the world, and to our listeners on the Westwood One radio network and Sirius XM channel 116. I'm Chris Cuomo, and we really are thrilled to have you all with us. Now, there have been debates, there have been interviews. Tonight, something different. A chance for the people who will decide to ask the questions themselves. As you know, the people of this state are the first in the nation to have a say on who will serve in the Oval Office. They only have 7 days left to make up their minds. In this hall tonight, Iowa voters who plan to attend the Democratic caucuses next Monday night. They were invited by CNN and our partners, the Iowa Democratic Party and Drake University. Audience members submitted questions to us. We have screened them to make sure they cover a variety of important issues, and they do. However, the candidates do not know what the questions will be. Many of the voters joining us tonight are undecided. Some are leaning toward a particular candidate. Now, in a bit, we're going to talk with Governor Martin O'Malley and Secretary Hillary Clinton. But first, please welcome Senator Bernie Sanders of Vermont.
Hey, Chris, how are you, man?
Good to see you, Senator. Busy day?
Yes. And my wife told me to button my coat, but I think I'm too fat, so I'm going to keep it like that.
I'll do the same then. I'll do the same. So, do you remember when we first started talking about this election many months ago? You weren't sure that you wanted to run. You were not sure, you said, that there was an appetite in this country to discuss the problems between rich and poor. How surprised are you by hashtag Feel the Burn and all that has followed?
Chris, our message has resonated much faster, much further than I thought it would. And I think what the American people are perceiving is there is something very wrong in this country when ordinary Americans are working longer hours for low wages, when we have the highest rate of childhood poverty of any major country on earth, and almost all new income and wealth is going to the top 1%. And then on top of that, people see that that rigged economy is sustained by a corrupt, and I use that word advisedly, a corrupt campaign finance system that allows billionaires today to spend as much money as they want through super PACs to elect the candidates of their choice. And all over this country, and it's not just Democrats, it is conservatives, it is Republicans are saying that is not what America is supposed to be about. So if you're asking me, why is it that our campaign has created the kind of momentum that it has? I think we are touching a nerve with the American people who understand that establishment politics is just not good enough. We need bold changes. We need a political revolution.
So you have centered your campaign on this idea of income inequality. Interestingly, President Obama, talking about the job just this morning, says you do not have the luxury of focusing on just one thing when you're president of the United States. You have to be able to handle many different priorities. Do you think you are up to the whole job?
Of course. President Obama is obviously right. Being a president is an enormously difficult job. It's a job that entails dealing with a million different issues. I think I have the background. I think I have the judgment to do that. I would remind you and remind the viewers that in 2002, when George W. Bush and Dick Cheney said we should go to war in Iraq, Bernie Sanders listened very carefully, and I said, no, I think that war is a dumb idea. I helped lead the opposition to that war. And if you go to my website, listen to what I said, and sadly enough, it gives me no joy. much of what I feared would happen did happen. I do believe I have the background for the job.
Well, it is time for you to make the case. Let's do it with the people who matter, the voters. The first question for you, Senator Sanders, comes from Jerry Odie. She says she is an undecided voter. Jerry?
Yes, Senator, some of your detractors have called you a socialist on occasions, and you don't seem too troubled by that and sometimes embrace it. I wondered if you could elaborate on that, and just to show us what the comfort level you have, your definition of it, so that it doesn't concern the rest of us citizens.
Well, what democratic socialism means, to me, is that economic rights, the right for economic security, should exist in the United States of America. It means to me that there's something wrong when we have millions of senior citizens today trying to get by on $11,000, $12,000 a year Social Security. It means there's something wrong when the rich get richer and almost everybody else gets poor. It means there is something wrong, and government should play a role in making sure that all of our kids, regardless of their income, are able to get a higher education, which is why I'm calling for free tuition at public colleges and universities, and why we have to deal with this horrendous level of student debt that people are having. Now, what's going on in countries around the world, in Scandinavia and in Germany, the ideas that I am talking about are not radical ideas. So what democratic socialism means to me in its essence is that we cannot continue to have a government dominated by the billionaire class and a Congress that continues to work for the interest of the people on top while ignoring working families. What this campaign is about, and what I believe in, is creating a government that works for all of us, not just a handful of people on the top. That's my definition of democratic socialism.
Next question, Renee Seagren. She's a nurse. She says she's undecided. She sees how health care plays out every day. She has a concern for you. Please, Renee.
Senator Sanders, you have branded your program, your single-payer health program, as Medicare for All. And Medicare has a reputation of having some problems. Let me cite one example. A man in our clinic went into the donut hole in September and could not afford the $1,200 a month it would cost him for insulin. So he had to decrease his dose to make his insulin stretch. So why do you think that people would support your Medicare for All program?
Well, I think people will support my Medicare for All program because the United States today is the only major country on earth that doesn't guarantee health care to all people as a right. Now, I'm on the committee that wrote the Affordable Care Act, and I think the Affordable Care Act has done a lot of good things. But yet we have 29 million people without any health insurance. Your point is there are seniors today, and I meet them every day, who cannot afford the outrageously high cost of prescription drugs because in America, everybody should know this. We pay by far the highest prices in the world for prescription drugs. Last year, while 1 out of 5 Americans cannot afford the prescriptions their doctors write, last year the 3 major drug companies made $45 billion in profit because they spent hundreds of millions of dollars on lobbying and campaign contributions. So I believe we should join the rest of the world. I believe as a principle, everybody should be entitled to health care as a right, comprehensive health care. And by the way, if we move toward a Medicare for all, not only do we cover the needs of all people, including that gentleman, we will save middle-class people thousands of dollars a year on their health care bills because now we pay, by far, per capita, much, much more than any other country on earth. It is time, in my view, for us to have the courage to take on the insurance companies, take on the drug companies, and provide health care to all people at an affordable cost.
The criticism is to pay for this. What you're really asking for is one of the biggest tax hikes in history. And that is the criticism.
But Chris, that is an unfair criticism for the following reason. If you are paying now $10,000 a year to a private health insurance company, and I say to you hypothetically, You're going to pay $5,000 more in taxes, or actually less than that, but you're not going to pay any more private health insurance. Are you going to be complaining about the fact that I've saved you $5,000 in your total bills? So it's demagogic to say, oh, you're paying more in taxes. Let's also talk about we are going to eliminate private health insurance premiums and payments, not only for individuals, but for businesses as well. Again, we are the only country on earth that allows private insurance companies to rip us off. We spend 3 times more than the British, 50% more than the French. We can do better than we're doing right now.
But just to be clear, you are going to raise taxes to do this.
Yes, we will raise taxes. Yes, we will. But also let us be clear, Chris, because there's a little bit of disingenuity out there. We may raise taxes, but we are also going to eliminate private health insurance premiums for individuals and for businesses.
All right, next question. Sean Collins.